I'm Stephen Porges. I'm professor of psychiatry at the University of North Carolina. I'm interested in what I'm interested in because it's in my whole life's journey to try to understand the relationship between physiological measures or physiological activity, health, and mental processes. Our team was put together based upon a theoretical perspective. And that theoretical perspective was based upon a theory that I developed called the polyvagal theory. The polyvagal theory links the autonomic nervous system to health and to social behavior. And it demonstrates how adverse effects in the environment, such as danger and life threat, can retune the autonomic nervous system and create vulnerabilities and functionally accelerate aging. The aging process is really associated with deteriorations and breakdowns in feedback loops in underlying neural circuits and underlying biochemical circuits. When we understand the role of the feedback loops, we can optimize the systems to work for longer periods of time to optimize the human experience. Now, from this perspective, it's the autonomic nervous system that has the primary role to monitor, to create the surveillance of these underlying physiological systems. And this works great as long as the autonomic nervous system is not subjugated and recruited for defense strategies. There's money out there, but there's not money out there to ask questions about common processes that underlie the aging process, common processes related to monitoring certain aspects of systems, and there's basically $0 for developing new technologies. I was drawn to the Palo Alto Prize competition because it asks a great question, and also because it's the opportunity to put together a team that I've never had the opportunity to put together before, to ask the question in a different way. Not only are we interested in the neurophysiology of heart rate variability signals, we're interested in how we can apply technologies to measure heart rate variability accurately without putting electrodes on people. If we can do that, we have tremendous broad applications of the technology to measure shifts in autonomic function. The disease of aging affected me probably most personally with my mother, who was lost a lot of her senses of interaction, lost her sense of health in her early 80s, which I now view as much too young to, in a sense, leave the dynamic interaction with family and with friends. So it's a very complex and literally recursive experience when you see your own parents degenerating and disengaging. We see ourselves at that same possibility, and we know that we want our children to have a good life as well. We also know people that have aged too soon. So I've had colleagues who have actually they've died and they've had premature Parkinson's that removed them from an understanding of the professional world. I went to a festschrift of a close friend. He didn't recognize me. And he was 62 at that point. We currently have a contract with DARPA, the Defense Advanced Research Project Agency. Here are two of my colleagues working on that project, Dr. Greg Lewis and Dr. Maria Davia. I think our team is different from other competitors because of our focus on a systems model. We're doing this because we believe that we will discover new technologies, new methodologies that will benefit mankind. So I selected two other senior people to create this team. Each of us has our own laboratories. I selected my colleague, collaborator, and my wife, Dr. Sue Carter, who discovered the important linkage between oxytocin and social behavior. The third member of our team is Bob Navio. Bob is the founder and the co-director of the Mitochondrial and Metabolic Disease Center at UC San Diego Medical School. Once we understand how to reduce the diseases associated with the autonomic nervous system and to optimize autonomic function, then lifespans will expand. We forget that lots of diseases, including cancer, are intimately related to the autonomic nervous system. It's not merely the expanding of a lifespan, it's a healthy lifespan. And as we increase the duration of a healthy lifespan, we have more creative, more productive, more interactive people who create a different level of society. I think now is the time for our science to really give back to society. I think it's the time for our science to give back, to have a better understanding of aging, to accelerate our investment in science, transforming the quality of care to human beings so that we live higher quality lives for longer periods of time.